Our last panelist is Dr. George Fernando, who's from the School of Public Health, and is also with the Center for Public Health Preparedness for the University.
Thank you so much. And we're going to go a little bit different way. This is, there are some risk communicators who work out of Princeton, Peter Sandman and his wife, Joni Lannard. And what's been going on for about the past 10 years is this is kind of a classic situation where people in public health have been looking one way. We've been looking at this bird flu, which probably everybody has heard about, and you know, the dying chickens and the pigeons falling out of the sky and other things that we've been considering. And then just when we're staring at this, these birds, there's this unique flu that has some swine DNA in it, some swine genetic material in it, some human genetic flu material in it, and some bird genetic flu material in it. So, but we have done some planning, and the planning included trying to figure out how to communicate to people just like you. So as a kind of a segue between the background material that you've received from the other speakers, we're going to walk through some of these, not all 25, but some of these messages that people like me and other risk communicators have tried to think of what to communicate with you when we get to level 4 and 5. Right now we're at World Health Organization level 5, which probably many of you have heard, is not based on how severe the virus is. It's just based on how far around the globe it has become. And so to get to level 5 out of 6, these are kind of like those color codes that we all made up after 9/11. These WHO codes are based on how to communicate to people around the world where we are. So right now we're at level 5, and let's see, he told me I could maybe, oh, there's my little pointer, see that helps you work. We're at level 5, which just means that it's in 2 or more countries. Well, we saw that picture, we saw that it's in a whole bunch of countries. So what are the other questions? Well, here we're already, one of our big questions. The pandemic is about to start. Now that's where we're at right now. We're sitting there. Is it a pandemic? Well, it's clearly going around the globe, but it's not really occurring all throughout the society. One of the things that's going to happen right now is that the Centers for Disease Control is going to try to get away from talking to the public about numbers. In fact, I think it was 403 was the number yesterday. Today it's actually up to 685 as of this morning, with 800 probable cases. But that's because they're finishing all the lab work. Everybody, all the docs and the other laboratorians on the phone calls that I've been on have been complaining that there's a backup at CDC, there's a backup at the different state labs. But you don't have to worry, and we're not going to be projecting to you these numbers as much as we're going to be talking about the amount of activity in the community. It's going to be things like, is there a low level of activity? Is there a moderate level of activity? Is there a high level of activity? And that's what normally happens during the regular seasonal flu. So yes, it looks like a pandemic is about to start or has started, but we're also going to move away from the numbers game, which you will see on TV. That's a classic one. The newspaper guys always love to say, you said it was 403, your partner said it was 404. Why don't you guys have your numbers together? This one I already talked about. It's not about the birds at the moment. There is one documented transmission of human to swine in the United States. So there is some possibility of this going back and forth, but it's not about the birds at the moment. There's no documentation that this particular swine flu or this particular H1N1 goes to birds, although it does have some genetic material from avian influenza in it. This one is more urgent than the previous. Now, this is a hard message to tell you. We're telling you to relax. It doesn't look as bad as we were afraid of. But really what's going on is that we don't know what's going to happen between now and October and November. This is gone. This will now go through South America, parts of Africa, parts of Southern Asia below the equator. It'll be interesting to see what's going on in New Zealand, which has more of a winter, kind of like the United States winter. Maybe it will be very mild in those parts of the world. Maybe it won't be very mild. Many of you, I suspect, have already heard that the original 1918 flu was very mild when it first passed through the United States. It went around the world, and by the time it got back to the United States, it was much more virulent, much more damaging to people. We don't really know whether that's going to happen. We're all hoping that this very mild spring flu, by the time it makes its way around the planet and comes back around to see us again in the fall, presuming it comes back to see us again in the fall, we're hoping it's mild then too. But we really don't know that answer. So this is, in fact, a new warning, and we're going to keep talking to you about that. I suspect there's some people even here tonight. I know I've had my own relatives have said to me, gee, you've beaten the drum again, and here it is, it's really not that bad. And my answer to them is, I am happy it's not that bad, but you know me, I'm going to keep beating the drum through June and July and August and September, and then I'm going to be the first one in line at wherever I can get my vaccine. I get my vaccines at Walgreens. I don't know if anybody else gets them there, but I'm right in line with everybody else to get my as early as possible in the season so I can have as long a protection as possible. Some of my friends wait until November and December and even January, and my feeling is that I want the length of time vaccine as the best I can possibly get. So this is us. That's why it's in red. The experts still aren't sure. We're not going to be sure. And one of the best things that the federal government has done, as you've been following this, is that many of the spokespeople for the federal government have said when they don't know something. That's better than false reassurance. The don't worry about it. Or this probably, he probably got it by, fishing in the mountains of North Carolina. That's a famous one in risk communication. That was about the first anthrax case. He probably got it while he was fishing. You try not to say things like that. You try to be straight with the public and say, we really don't know. So right now, we're not sure. We're hoping it's going to be mild, but we're not going to be sure for a while. We don't know how bad it will be. That's really another one from there. Here's what we know so far about the severity issue. At first, when this started occurring in Mexico, and this is really what rang our bell, many deaths were reported. And when you see a certain number of cases, for the sake of our conversation, 1,000 people with a new influenza, and say 100 have died, that's a 10% death rate. We're not used to those kind of death rates. That's really what got people in public health worried, is that we're going to see a 10% death rate. It doesn't matter if you have 600 cases or 700 cases, you're still going to lose 60 people. That's a lot of people to lose. So at first, we were really worried about the severity issue. Now that there's been more time for the Mexican government and the Mexican medical and public health establishment to actually do many autopsies on those people who have passed away and died, they've attributed many of those cases, many of those deaths, to other illnesses. That's a good idea, but there was that discrepancy, and that's really what drove the anxiety of the public health and the medical community over the past couple of weeks, is that for probably 4 or 5 days, we saw a lot of deaths in Mexico, not quite as many deaths here. In fact, we just have 2 deaths now. One in a youngster who came to the United States, was in Mexico, and another with a woman who's in her early 30s. I believe that her age is like 32 or 33. So 2 is still a higher number, a new number, but it's not what we thought it was. Maybe this will change as we come to the fall. It may be very bad, but this is a message that we try to point out. We're going to make it through this somehow. There's been an incredible amount of planning. I and a lot of people in this room responded to 9/11, and for better or for worse, there wasn't really a lot of planning prior to that to deal with the situation. There wasn't a lot of planning prior to that outside of laboratories to deal with anthrax. really there's been a remarkable amount of planning with this, and you've seen the plan roll out at the federal level, actually at the state and the local level, and that's why at least those of us who are working in this field, this plan has worked as it was written, and that has some comfort to us. This is the window of opportunity, and this is really my message to you right now for practical preparations. One of the messages that hasn't quite gotten out yet is we in preparedness, public health preparedness, are constantly telling people to develop a 2 or 3 day store of materials in their home, like those water bottles that we've got. Don't you always love it? You know, the speakers get to have water bottles. There's a sign outside that says no water and food, but then you come inside and the speakers always have water bottles. I like that as a speaker. But you want to have these water bottles at home. You don't want to be in a situation like the classic Central and South Jersey snowstorm. You know, you get a 1/4 inch of snow, and everybody shows up at the ShopRite or the Super Shop and Save or whatever you've got down here. We don't have Kroger's. You got a couple of Wegmans. You want that stuff in your house, and this is the time to imagine if 25% of the workers where you work had been sent home. If you had been sent home and told to not circulate in the community for a week. That sounds like a great thing when you put it on a PowerPoint slide. Go home if you have the flu and stay inside. Well, I don't know about you. I've got 2 kids, I've got a wife, I've got all this other stuff going on. I'm not in a situation to, at least well prepared, to just sit in my house for a week and not keep my life rolling. So I should have more food, whatever little pantry I might have, water, dried materials. If you need extra scripts, you know, if you're on medication, usually they don't let you hold on to prescriptions anymore, do they? You used to be able to store those and convince your doctor to write you an extra. It doesn't work that way anymore. But you want to have a piece of paper with all your contacts. The last time I got the flu, I'm 59 now, I got the flu when I was 50. I was flat on my back for 2 full days. I was really sick. I wasn't in any condition to communicate well with my wife. My wife would joke and say, I'm never in a condition to communicate well with my wife. But I wasn't in a condition to communicate with her. And I can only imagine if I was on the average number of medications that a Medicare patient is on. The average Medicare patient is on 10 medications. If you've got a fever of 102, 103, 104, and one of your nice grandsons or granddaughters or your children come by and says, Grandma, what are you on? What medications you're on? Your answer is going to be, I'm on a heart pill, I'm on a kidney pill. You're not going to be in a situation to really communicate well with your relatives. So that's another type of personal preparation you need to do. And now you have a window of opportunity to do that. If it's not bad in the fall, what's the problem? You've got a couple extra cases of water in the basement or in the garage or someplace. You've written this material down. You've talked to your kids or your relatives about this stuff, and they can call you the worry wart. I don't know about you, my kids call me the worry wart anyway. You can imagine how worried I am around the house all the time and how much fun the kids make of me about being worried about all this stuff. So that's really what we're talking about to me right now, is we've had our run through, and now when I'm going to be talking to schools and businesses and communities, what I'm going to be talking about, what would have happened if your school had closed down for 2 weeks. I'm on the Princeton Public Health Board. We still are, the schools were talking about it and dealing with the situation, but it wasn't clear to me on the Public Health Board, were they going to extend school for 2 weeks? Were they going to figure out, they're going to go into July, or were they going to figure out how to clean up school and finish it and get a full school year? We asked the New Jersey Department of Education that question. If we close for 2 weeks right at the end of the semester, what winds up happening? So I'm hoping the state and the education department will figure that out. So if we do wind up closing schools, we'll know what to do. We had the same conversations at UMDNJ. What happens if the medical school has to close for 2 weeks? What happens if the dental school up in Newark has to close, or the School of Public Health has to close? What exactly is going to go on? And how would we make those decisions and communicate with them, with each other? So this is what community preparation does, And I'm not going to spend quite as much time on this, but I've already talked to you. Let's see if I can get my little arrow to go again. I don't, let's see, where is it? I can't make it go. So see, low tech, that's the one I'm talking to you about. Helping your household deal with your pandemic needs or plan for those pandemic needs. Now, has everybody heard this modern phrase of social distancing? This really just means staying away from each other. The way they're doing social distancing in Mexico City right now, they reopened the restaurants yesterday, but each restaurant, each table has to be 6 feet from the next table. Now, I don't know about you, if I'm in a restaurant, I'm okay with that because I like my privacy anyway. But I listened to one business person, and that means they had half the tables and half the income in that restaurant. So they did open the restaurants, but there are a lot of things that we public health types have thought up. We think they're a good idea. We don't really know. We don't have data on this because we haven't tried it. We haven't tried making fewer tables at the restaurant or trying to keep people away from the mall. I can just hear the business people saying, when I try to keep them away from the mall, the economy is going into the dumper, and you want to keep people away from the mall? What are you thinking? So there's going to be a lot of talk. There's been a lot of talk in public health. There'll be more talk in the fall if things really get bad about these social distancing ideas. But you probably may want to talk, if you're involved at all in the community, about what you would do or whether you even think it's a good idea to start talking about how to keep people away from congregating. There is data that in 1918, very different, right? You know, no superhighways, no Eisenhower interstate system, no this, no that. But the communities that shut down the theaters, these are new movie theaters, but just regular public performances, concert halls, closed their schools early and kept them closed. Those communities had lower death rates. They had them actually almost the same number of deaths, but the peak didn't go as high. The pandemic went a little slower through the community. And if you think about it, your community fares better if it's a slower hit on the community, even if, frankly, the same number of people wind up dying, because the community can keep going, as opposed to the community going totally offline. Philadelphia is famous, unfortunately, for maintaining a big parade right at the peak of the pandemic and helping spread the pandemic influenza throughout Philly faster than it would have normally been spread. There's another famous story about a U.S. warship that was going to World War I, where there were a couple of cases, and it took longer to get across the Atlantic back in those days, and slowly as it went across the Atlantic, all these young men got pandemic influenza from 1918, and a lot of them wound up dying. So I've already talked about school closings. I won't go through it again. How many people have kids in school? Probably not a lot of people in the audience, but a few. You can imagine if the kids, my kids are going to stay home, my daughter's going to be bored that day she gets sent home, not like 2 days later. And then we're going to have to figure out what to do with her and how to keep her busy and keep her out of trouble. The reason we push hand washing is not because it's perfect, but gee, it gives you some action to do. Now, what I've been trained to do, if you really try to wash your hands the way we tell you to wash your hands, we tell you to wash your hands to sing happy birthday twice. That's a long time to wash your hands, especially on the turnpike with that cold water. The cold water going through. But even when I talk to physicians about doing this, if every physician washed their hands for that long after they had every patient encounter where they touched the patient, they would have to cut down the number of patients they see in a day. They'd spend about 15 minutes washing their hands. So that's why we get these other types of gels and other types of materials. But it is easy to do, it's under your control, and there's really no problem unless you're touching people all day long like nurses and doctors wind up doing. Wearing a mask might help a bit. If you can get some of these surgical masks, you have a little opportunity to buy some, they'll go back on the shelves. I wouldn't buy the most expensive ones, I buy my N95 respirators and my surgical masks at Home Depot. Because these are the same, the N95 respirators are the same one that the painters use. They've got the buttons at the end of them, and I actually get them cheaper there than I get them at the medical supply stores. They don't have the same surgical masks, but what you're really trying to do, we saw a picture of that looked like a surgical resident, right? And so as an internist, we always like to make fun of surgeons, but coughing and making this big explosion. The surgical masks are good for doing that, but so is this. And the big thing I like to tell people is to think, though, about how you would take care of a relative at home and how you would stop that relative from coughing into your face. And what I try to tell people is that you will wind up turning your head away, frankly. Is it going to protect you totally? Who knows? It might help you from not getting infected, but your relative's not going to have a surgical mask on all day long, especially if they're, as we heard, pulmonary compromised, and you're not going to do the same thing. So you're going to be washing your hands, you're going to be limiting your contact with your relative, you're going to be turning away when they cough. You'll probably wind up, you have a good chance of getting infected in any case. So prepare for those possible shortages. It's not too late to stockpile now. 16 doesn't count. See, we thought when we were writing these things, or when Sandman and his wife were writing these things and people were discussing them, that by the time the pandemic hit, it would be like that snowfall. You wouldn't even think of going to the store. You have an opportunity to build your stockpile now. That's at least the third time I've said that to you. Maybe a couple people will build their stockpile now. It's also time to think of how you would care for your loved ones at home. You have some time to think this through. And you may be the lucky one not to get it, which means, if I'm the one who doesn't get it, I'm going to be taking care of my wife and my 2 kids. They will be miserable, and I will have to figure out how to, make them feel, and then maybe I'll get sick after they, get better, and we'll just have to figure out how to keep that ball rolling. For all I know, I'm going to be helping take care, or you're going to be, so some of my neighbors are going to be helping take care of me. Who knows? We will need volunteers. I'm a member, and every county in New Jersey has developed a medical reserve corps of doctors and nurses who will do some type of activities during emergencies like this. We don't really know exactly what those activities are going to be. In New Jersey, in Mercer County, which is where the state health department is, doctors and nurses went to the phone lines at the Emergency Operations Center and took phone calls from other doctors and nurses throughout New Jersey over the past 10 days. So the doctors and nurses who had problems, had a patient that they were seeing, they would call the line, and if you told them on the line that you were a clinician, they would hook you up with another clinician volunteer. It's harder if you're in Pennsylvania. If I'm in Pennsylvania traveling, I don't have a license there. In the United States, licensure is within the state. So if you don't have a license in the 2 states, it can get very touch and go. People are very touchy about people practicing medicine, practicing nursing outside of their state. But you may be able to help, and this may be something, if you haven't had an opportunity to volunteer lately, this may be something you want to look into in your own county. So this is what we talk about, sustaining the flow of essential goods and services. The #1 employer in New Jersey, this varies sometimes, but the big employers in New Jersey are PSE&G, Verizon, UPS. We all get our stuff in the mail from Amazon.com. Those are really the big employers, and I believe it's ShopRite or Pathmark. I get confused of which one. But you can imagine, it's great if, it's too bad if the school shuts down. We don't want the school to shut down. But if the school shuts down, the medical school shuts down, the world will go on. If UPS, Verizon, PSE&G, and ShopRite, if they shut down, we're in deep weeds, right? My phone doesn't, well, gee, I got my daughter home and the internet doesn't work, that's not going to work too well. So sustaining this flow of essential goods and services, I'm making a little bit of joke about it, but that's going to be the big problem. Or in a hospital, it's great, I feel sorry for the doctors and the nurses. We're very important. We doctors and nurses are very important. But the people that go in and clean the room afterwards, they're making the least amount of money if they get sent home for a week and have, they don't have a lot of sick time left. They get sent home for a week, they come back. If we don't have those people, the hospitals will shut down just as easily for lack of hospital cleanup as it will for lack of doctors and nurses. In fact, for all I know, it'll happen faster if there's nobody to clean up the rooms. So this is going to be a big problem, and I hope people have found religion on number 19. So I think you've seen what the government will be doing. At this point, try not to overreact, but also try not to flush all these ideas. Obviously, by coming here even tonight, you're still interested, but you'll hear the feedback and kind of the poo-pooing of this over the next couple of weeks. Gee, everybody overreacted. Like I said, my relatives are already telling me that we cried wolf again. But try not to switch this off, because we're pretty sure it'll come back in the fall. We don't absolutely know that, but we're pretty sure they're going to come back in the fall. And this looks like, we hope riots, panics, and other sorts of civil disorder will not be common, but it's important to be on guard. I think we have some data on this. On 9/11 and after anthrax, there weren't riots about things. People didn't go nuts about stuff. The workers at the post office near here in Belmar and in Hamilton in New Jersey and in other places, those men and women kept going to work. So people didn't really wind up freaking out. But we do, maybe this will be worse. If it is worse, maybe some people will get upset and do things that they shouldn't do. But we'll have to deal with that as it comes around. So I think you're seeing that people are going to try to be candid and tell you the straight story. We have learned some lessons over the past 10 years with anthrax and other things. There will be some confusion. In 72 hours, on Thursday of last week, they were closing schools for a week. On Friday, they were closing schools for 2 weeks, and as of Monday, they weren't closing schools at all. But even with that, the government was better than they were last time. They just explained to people why they changed their mind and why they gave different data. And some of the school people that were on the conference calls I were on, they were a little upset about that. Well, you said one thing yesterday, you said another thing today, you said the third thing 2 days from now. What's up with that? And what the government has decided to start doing, which to me is treating everybody else like adults, is saying, we're doing the best we can. This is the data we're basing this on. If the data changes, we're going to change our action. So I'm going to leave you with two final things. They keep talking about 1918, but this could be like 1957. The 57 outbreak, it was bad, but it wasn't like 1918. Or it could be like the 1968 outbreak. That was even milder. So we really don't know that it's going to be 1918. When I gave my last class, a lecture to Rutgers students a couple of days ago, I really freaked them out. I was too serious. So I'm trying to lighten up a little bit, because I don't want everybody to go out of here depressed and feeling like the world's going to come to an end. Maybe it will be bad. And 1957 was pretty bad. It doubled the number of deaths in this country. And the number of deaths from regular influenza is the same as the number of deaths from automobile accidents. If I would say automobile accident deaths are a big problem in the United States, most people would say, yeah, that's a really big problem. That's really bad. We all drive on the turnpike and the parkway and 295, and we don't want to be run into by somebody. Well, influenza is just as bad as that. And the good pandemic in 57 doubled the number of deaths. So even a good one is pretty bad. It just doesn't destroy society or disrupt the very fabric of society like 1918 did. So maybe that won't happen. Maybe we'll have a 57, maybe we'll have a 68, or what will probably happen is we'll call it a 2009 because it'll be unique in its own way. So stay in touch. This is what we keep saying. Here's some more information. Here's how you get additional information. These days, the answer to all these questions is to go online and to go to the CDC website. There's also a very good federal website for all types of preparedness. It's really easy to remember. It's www.ready, like getting ready, ready.gov. So if you go to ready.gov, ready.gov, you'll get all this information and more. You'll have a checklist on how to prepare your house and things like that. You'll see a little widget, it's called, that you can click on. You can find everything you want to know about pandemic influenza. If you have friends who speak Spanish, you can go to a Spanish page. They don't have an Italian page for me yet, but they got Chinese, they got a bunch of other pages that you can get to. So ready.gov, to me, that's where I tell people to go, and you can get to all the other websites with that. So I'm done with that last slide, and it sounds like we'll go to question and answers after this.
you everyone for speaking. Hi, Dr. Condalucci.
Hello.
My name is Kimberly Tyler, and the reason I came tonight is I know, Dr. Condalucci, you deal with a lot of people that have chronic viral diseases, and I was wondering, as of today or in the update on traveling, I myself have a chronic illness, and I'm wondering, I'm going to be going to Texas at the end of the month. What's your feeling on border states and how the disease is progressing in those states, and how do you feel about traveling? No one mentioned anything about traveling at this point, and I'd really like to know how you feel about that.
I think I don't know, did they lift the ban on traveling? Or not the ban, but they suggested limiting the travel to Mexico to just essential travel. You know, I think you'll have to see how things are in the month from now. But I think that, you know, you want to minimize your travel if, you know, unless it's absolutely necessary. But things may change in a month. So, you know, by then, you might be through that area. There's very little, you know, spread of influenza in Texas, because that was one of the earliest states that, you know, so, right. So, I mean, I think you know, you can go to CDC and they'll, you know, you'll know what the travel advisories are at that time. But, you know, if you don't have to travel during a pandemic, it's the best thing to do.
Thank you for mentioning. I didn't hear anything about traveling.
Yeah.
I just was wondering what the latest was.
Yeah, as of this morning, the suggestion from the CDC to limit Mexican travel to necessary travel was still on. That one is, I know that they evaluate that one every day, literally. There's no suggestion of not going to Texas, although, you know, if you go to a certain part of Texas where the schools are closed down and there have been a lot of cases, you know, that's one thing. If you're going to Boston or New York City even, which has had quite a few cases also, if it was me, you know, I'm aware of where I'm going in the city. I think really the change in the weather is what is going to be working in, like, your benefit with the chronic illness or all of our benefits. The influenza just doesn't like being in the sun and in the warmth. And so if this weather ever breaks, you know, this nice warm weather we had ever breaks, once it gets warmer, travel should be much less of a worry. And you said you were traveling in about a month. I think that'll be even less of a worry then.
Can you explain the role of real-time PCR and other lab tests for H1N1 or flu in general?
Well, I mean, what you get now is in the emergency room or in physician's offices that you'll get, it's influenza A. The state is limiting specimens for confirmation from the emergency rooms only if people are admitted to the hospital with severe disease to confirm that it's swine flu. So, you know, you have to put a influenza A positivity in context of a pandemic. So, I mean, if you have someone that's traveled to Mexico, comes back and has influenza A positive, and they're sick, there's probably a good chance that it's swine flu, but, you know, you have to send it out for confirmation. Now, I think that the CDC is revving up the states to do their own testing and make it more available. But I don't know if that answered your question. But
Partly. Say someone comes to the ER, they've got the travel, they've got the symptoms.
Yeah.
What are you looking for in the test that's done in the ER to decide whether or not is it just the fact they've got some A, strongly positive A?
if it's influenza A, yeah, that, and then in the proper context. If it gets admitted to the hospital, they can send that specimen to the state with a little history of it, and eventually it'll get to the CDC and be confirmed.
The testing is mostly done to document on a community basis whether there's the pandemic influenza in that community. It really doesn't change the treatment at the moment. It doesn't change the treatment of the patient to know that it's pandemic A versus there's still some seasonal A going around. So if somebody comes in the emergency room with a moderate case, they find out they've got A of some sort, but they're going to be sent home. There's no benefit to the patient of knowing whether it's the new one or the seasonal one. And during the regular season, most people who are told that they have influenza actually aren't tested. It's a clinical diagnosis. It will be interesting to see, frankly, or bluntly, in the fall, if there's both seasonal flu running around and pandemic flu running around, how people, both clinicians who are making a diagnosis, and more interestingly, patients, whether patients will demand to know. There's no obvious benefit to knowing, but there might be a benefit. There might be a perceived benefit to knowing, and that would put a lot of stress on our lab system. We don't have the lab capability to test 10% of the population in real time.
Do we know whether this present strain of the swine flu is traditional in that it affects mostly the young, the very young, and the very old, or is this the one that the healthy people, like 20 to 40, will be more severely reacting to this?
So far, the data that comes from the CDC on their website is collected to speak directly to that question. And as of yesterday at 3:30, I wasn't on today's 3:30 conference call, the average age was still younger than the typical seasonal flu age. It has been getting progressively older, but it's still in the 30s. And typically flu is in the greater than 50-year-old age group as a mean, if you will, or as an average. So at the moment, this one looks like it is attacking a younger group, which makes sense because as far as we know, no human on the planet has seen this virus before. So it would make sense that it would be in a younger cohort of patients, and so far, that's what the data shows.
Thank you.
This week, I was fortunate enough 2 days ago to be on a conference call with the New York Department of Health. And interestingly enough, that there were some patients with flu-like symptoms that turned out to have, even though it's late in the season, they still had documented seasonal flu at this time. Now, how does the panel feel if someone did not have a flu shot yet this year, knowing that seasonal flu can occur in New York? I guess it can occur in Jersey as well. Do you still think it's possible, or should we still give the seasonal flu shot at this point in time if someone did not have a flu shot?
I suppose it would hurt them to do that. It's kind of late. I don't even know if most places may not even have any flu vaccine around right now, but
I can say that the director of viral infections at CDC as of Monday was answering that very question by saying, yes, give people, if you have it, give people the current seasonal vaccine if they haven't had it before. But I think the points that Dr. Condalucci brings up about just the practicality of doing that went through my head. But we're still seeing, in fact, you can see seasonal cases. There's no rule to say that oh, it's May, you can't have influenza. The acting head of the CDC said that the bug doesn't read the plan. So the bug doesn't sit there and go, no, I'm not allowed to get people sick this month.
My second question is that I know it's taken us some time, and actually we were the last school out of all the schools to finally offer flu vaccine to all our students and nurses and faculty, et cetera. And we did it last year, but our success rate, I guess, just as David mentioned, I think you said 40% at the hospital.
40% this year, yeah.
We had about 35% success here at the university in this particular school. should we now start pushing and getting everybody tuned to the concept of getting flu shots for next year? And secondly, even though there's not a swine vaccine available now, conceivably there could be one in the fall when the next phase of this theoretically may hit. Should we also start getting people attuned to possibly getting the swine flu vaccine if it's available at that time?
I just know, like, for the hospital and our opportunity, I'm going to use this as a platform to push, you know, more people to see if we can get our numbers, you know, more covered, more people being vaccinated, healthcare workers in the hospital. I mean, as George was saying, this is a great opportunity to use to get the word out and to help people understand how important it is to protect yourself against all influenza. Whether we'll have a, you know, maybe George will probably speak to this better than I, but we don't, you know, what type of vaccine we'll have in the fall, with whether there'll be a combination or separate vaccines. I don't know the answer to that. I don't think anybody actually has that answer yet, but this is a great opportunity to teach and to encourage people. See what happened. We want you to get vaccinated this year. And that old wise tale about people, you know, I have patients every year come in. I get the flu from the flu vaccine. It's a bunch of baloney. But, you know, some people just believe and insist upon it. But, you know, maybe this will wake people up to get vaccinated. And I'm hoping that'll be an opportunity for us to teach and to encourage more vaccinations. Maybe we can get higher numbers, you know, next year, I hope.
I agree. I think this heightened awareness will help us to increase the rate of vaccination in the fall. Few people pay attention to influenza each year, especially young people with young children. But I think now that there's a greater awareness of the public and they're making a lot of comparisons between what's going on now and what goes on with influenza every year, it will give us the opportunity to have more patients and more parents take advantage of the flu vaccine.
The 2 points. The healthcare worker population is 100% vaccinated against measles. You can't work. You can't come to work if you're not vaccinated against measles. Now, I respect measles. It's a bad actor. If a immunocompromised patient gets measles, that's a bad thing. But I am continually surprised that our thinking about influenza is about 20 years behind. For healthcare workers, it is still a personal choice whether you get vaccinated to come to work. And we sit, and I've been through this with lots of healthcare workers. Well, you know, I'm such and so an age, I've never gotten it, I don't want to get it. So as you can probably imagine, I have flipped to the I don't understand why it's not mandatory. If it's mandatory to get measles and chickenpox and hepatitis B, if I understand it correctly, certainly my kids to go to high school have to get vaccinated for Hep B. So I don't understand why a healthcare worker can walk into an intensive care unit and not be vaccinated for influenza. It just, I've become radicalized on the issue. The current thinking, to switch gears on what the vaccine will look like in the fall, is they are completing their production of the seasonal flu vaccine. That was already in the pipeline. There was some discussion of disrupting that production and maybe combining the two so you'd have one shot to give. But they really didn't know whether combining the new strain's vaccine with the current strain, what that would do to the production run. So the practical decision was made to complete the production run of the seasonal flu vaccine and then start, and I believe this decision has been made, I'll have to check to verify, but they are going to produce a fall vaccine. The debate now is whether it will be 1 or 2 shots. If you've got a kid with asthma, like my child, the first time she had to get, she was a youngster and had to get vaccinated, she had to have 2 shots. And so if you've never seen a flu vaccine before for a particular strain, many people, both young people and old people, frankly, need 2 doses to really get a good take. So I read yesterday from the head of the Advisory Committee for Information for Immunization Practices that they're discussing the two-shot regimen, which means, and this will be a tough sell for healthcare workers to patients, you wind up getting 3 shots. You get 1 shot with the seasonal vaccine and then 2 shots with the new vaccine. And that will be a complicated message to get out there. Obviously, I've made my statement about what I think the message should be to healthcare workers. Line up and get the shot, or you can't come to work. But I suspect that with healthcare workers, if we do have a bad pandemic, we will rapidly go to mandatory vaccination. It will be, and this will be a turning point where this will be before 2009, after 2009 in terms of healthcare worker vaccination. But how we craft our message to the public to encourage the public to get all 3 of these shots, if that's what it turns out to be. And it will be practically complicated to get a lot of people in. I like to go to the Walgreens or to the, to get my shot. I'll get my first 2 shots, but coming back, getting people back for that second shot, you always lose, from a pediatric point of view, what would you say? You lose 50% of the people for the second shot? So I'm a motivated consumer. I'll go back, but a lot of people won't necessarily have the time. They'll take their chances on the first shot.
2 more quickies. A theoretical question that hopefully, I'm sure we all hope does not occur, and that if there is a possibility of mutation occurring, second phase, if the second phase does occur, I guess we're not sure what's going to happen just yet. But let's say we've developed all these bugs developing a swine flu vaccine, and we have, at that time, we'll have a seasonal flu vaccine now, but mutation occurs. What do we do then as far as vaccinations concerned? We spend all these millions of dollars getting the swine flu vaccine. We still recommend, even though mutation has occurred, to give the swine flu vaccine. I'm sure there's no question about the seasonal flu, but should we get the swine flu vaccine at that point?
Well, the scenario that you paint is the situation we're in every year with seasonal flu. Is that the decision is made for people who don't necessarily know how this works. The decision is made in January or February which flu viruses to create a vaccine against. And then it takes you 6 months to make it. So in that 6-month period from February to September, October, things can change. So you're exactly right, things might change. We would have to be particularly unlucky, however. Usually, even if there's a virulence change, the vaccine still works against giving you some protection, either against getting the infection or the severity of the infection. So I would just say, under one of those principles, being straight with people, while it is possible that you could have a mutation that totally invalidates the new vaccine, it is very unlikely that an effective vaccine created will likely have a substantial benefit. Will it be perfect? The vaccines we have right now often only give 60% protection anyway. The best vaccines give 60 to 70% for influenza. So even those vaccines don't work perfectly. And if we get a 70% effective vaccine for the fall, that's about as good as we can do.
My last question is, I didn't hear any of the panel members address the issue of a pneumonia vaccine. Would the panel please comment as to your feelings about giving a pneumonia vaccine?
Generally, the pneumonia vaccine isn't given quite as frequently as the flu shot. However, I think would all agree that we strongly recommend patients who have, especially patients who have chronic disease, that they get pneumonia shots, because they're going to be the group of patients that have an increased risk of secondary infection with a bacterial pneumonia. The pneumonia shot vaccinates against a bacterial infection, whereas the flu shot obviously vaccinates against the flu. So I think, I think we all agree that you should stay getting vaccinated every 2, what did they say, 2 to 5?
It's 5.
Every 5 years, so it's not as hard to get people to do it.
5 over 55. I mean, the one question, and this will be debated, I'm sure, is if we have a novel, novel virulent return of whether to expand the use of pneumonia vaccine in the general population. I've heard minimal detailed conversation about that, but I know it's going to be considered whether to have. I believe in Mexico they actually chose to use quite a bit of pneumonia vaccine outside of the typical age groups.
And in children, as part of the routine vaccinations, they do receive the strep pneumonia vaccine during their first and second year of life. So they are already being vaccinated against that. But that's why, as in my presentation, I said that staph was one of the most common pneumonias because the children are protected against strep pneumo.
Mm-hmm. I think influenza A is famous for sucker punching the immune system and preparing it for a bacterial infection. So.
It's a question for Dr. Bradis. In one of your slides, you mentioned how it's young and healthy hosts that have been particularly vulnerable to H1N1. And I just wondered if you had any rationale for that, considering that we talked a lot about chronic disease and how you would think that they would be more susceptible to influenza and its complications.
I can speculate. My guess would be that, younger people are not getting the normal seasonal influenza A because it's sort of familiar to our immune systems and we're kind of fighting it off a little bit better. But the younger population is the one that's out there in the community more. So if it's a virgin virus that no one's ever seen before, that probably would be the group that would get infected if there's no previous immune response. But that's purely speculation.
Well, even in 1918 is famous for affecting people from 15 to 45, which don't normally get affected. But actually, if you wind up looking at the data, the typical very old and very young, they really got hit too. It's to a certain extent a societal reaction. You hate to put it in these terms, but there's some expectation that people my age and older, well, we get sick. And so it's too bad when an older person gets sick, but you sort of expect it. And younger people, very young, the less than one, again, they're in a very vulnerable period. They've just been born. Their immune system is not fully developed. But the societal reaction to seeing people in the prime of life, we saw this with the HIV epidemic in the 80s and 90s, where people just were not, with good reason. It's a good thing that society isn't accepting of people in the prime of life suffering. But even in 1918, the numbers still were incredibly high in the older and the younger populations. It's just we paid particular attention to the middle group.